Hi, I'm Dr. Mike Kelly, a plastic surgeon with over 30 years of experience. I know a thing or two about plastic surgery, and I love pizza. Now I'm traveling across the country to meet with the best plastic surgeons and find out what makes their procedure the best. This is Slices.
Hello.
Max.
Hey, Mike, how's it going?
It's great. It's great. Look, I'm just looking for a patient, and I wanted to see how the master of the Max Makeover was doing. You got anybody you're doing this week?
Yeah, actually, I've got a new mommy makeover scheduled this week. Patient Melissa. She had twins, and she's ready to get her body back in shape now.
Wow, that sounds great. Any chance I could go to surgery with you?
Yeah, sure. We can make that happen.
Awesome. How about we grab a slice the night before?
Good. Sounds great. I know of a new place called La Pizza.
Sounds great. Let's set it up. La Pizza is a South Miami staple known for its signature crust. It's Dr. Polo's favorite spot and a great place to learn about his signature procedure, the Max Makeover. What exactly is a Max Makeover?
Oh, that's my version of the mommy makeover. Routinely, it's a full tummy tuck and an aug and a lift.
But I've seen your work, and you do one of the best mommy makeovers I've ever seen.
Well, thanks.
What is it that makes your Max Makeover different from all the other plastic surgeons?
I use a lot of highly cohesive implants. And with the tummy tucks, I call it painless, drainless tummy tucks. So I use on-cue pumps, helps them not have to take so much narcotic.
What is it with these Miami moms, right? I mean, are they doing this in Cleveland? I don't think so. What's different down here?
I think they're doing it everywhere, but I mean, a lot of the moms here are definitely fit, and I think that makes it a little bit easier for us.
So when did you get to Miami?
Well, I came to med school here. That was in '89. So 89 to 93 was here. That's when we met,
Right. I was so happy to be here. I left Chicago, and I was back in Miami, and it just seemed like such a breeze. I was out of general surgery, doing plastic surgery.
I know how you feel, yeah. I did my general surgery in New York, in Brooklyn, and went to Chapel Hill, North Carolina for the plastic, so it was just like a different world,
Yeah,
it's
it
tough.
really is, and it's tough.
Yeah,
it's
exactly.
tough.
Right.
You're just tired all the time.
Yeah.
With plastic surgery, it just feels like you went to the country club now.
Right.
You've been working in the factory,
yes.
and now you're at the country club.
Yeah.
Don't you feel like plastic surgery is the best field there is?
Yeah, for sure.
I mean, do you ever have any regrets about choosing plastic surgery?
No, not at all. I'm happy every day with what I do. You just bring so much happiness to people in plastic surgery. I think that's what we love about it so much. You know? It's like every day you're getting that gratification from patients.
My friends often ask me, my wife asks me, is why do plastic surgeons have such big egos?
Well, it's hard to avoid, and I think one of the reasons why we, choose this field and why we love what we do so much is that gratification you get from patients every day.
My chairman used to say he wanted residents who, when he asked them to name the 5 best surgeons in the world, had trouble thinking of the other 4.
That's good.
That's the personality. And you don't want someone to operate on you,
right,
unless he looks at you and says, I can do that.
Right.
But you don't want a guy who goes, oh, I don't know, maybe I can, maybe I can't. You want somebody who looks at you and says, I'm going to fix that.
Yeah.
Right? I'm going to do that, right?
Yeah.
But it takes an ego to be able to say that.
You're right.
I find myself hanging pictures at home and doing this and expecting my wife to hand me the hammer, which doesn't go over well.
Yes,
right?
Exactly.
I just do this.
Exactly. Right. Yeah, that's all you need is a place like home to bring you back down to earth.
So Max, I'm glad we got to enjoy some pizza together. I'm excited about tomorrow. We're going to do the Max Makeover.
Yeah.
And we'll help Melissa achieve her dreams.
Yeah, she's the perfect candidate.
That's awesome.
Cheers.
Next on Slices, we check in with Dr. Polo's patient, Melissa, before her surgery.
Hi, this is Dr. Max Polo. I'm so happy that you've joined us today for the show. My 20 years of experience specializing in mommy makeover and breast augmentation surgery have provided me with the expertise to help each individual patient achieve their goals and dreams. If you'd like the Max Makeover, please schedule a virtual or in-person consultation with me at Miami Plastic Surgery. I look forward to seeing you.
Now that I've got the lowdown on Dr. Polo's Max Makeover, it's time to see him in surgery. First, I want to talk to Melissa, the patient for today. Hi, Melissa. How are you?
Good. How are you?
Good to see you. You finally made it. Tell me a little bit about yourself. What do you do?
What do? I'm a CAT scan technologist. I've been doing that for about 12 years. I'm a twin mom.
Oh, so that's how you got here.
They made me, you know.
They did it. They did a number.
They did it to me.
They did a number on you. Boys, girls?
I have a boy and a girl.
Okay, and how old are they now?
They're 4.5 now.
I saw the photos of when you were pregnant. That was amazing.
Yes.
It was amazing. It looked painful.
Yes, it was a rough pregnancy, but it was thankfully healthy and everything went well. But they did tear my abdominal muscles, and I do have a hernia that was caused by the pregnancy. Ever since I had my twins, I haven't really felt confident wearing the clothes that I want to wear. I never got back into a bikini, so I'm looking forward to that.
Well, you're in the right spot. You know, we're going to get you the Max Makeover, and
yes.
He's the best. That's why we're here.
Yes.
So we'll take good care of you, and we'll get started.
Sounds good. Super excited.
Dr. Polo is tackling Melissa's breast augmentation first. I'll be there to lend moral support and maybe give a hand if you'll let me.
The wedge section here. Are we at 40 and 40 there, Yvette?
35, 40.
Okay, that's fine. 35 for the cut? That's good.
Now, when you take out this wedge of tissue, how does that help you during surgery?
Well, I think that's a part of the secret sauce here. So, you know, I think it's important in these patients to narrow the breast as well. So, you know, I think doing that, mobilizing those pillars and squeezing the breast in like this, narrows the base of the breast and pushes the remaining breast volume under the nipple and up to the top of the breast, which is
helps
a big part of what you're trying to. Yes, exactly, right. Sometimes, you know, you don't want to reduce too much volume. You know, I'm not somebody who believes in reducing the patient's native breast volume and replacing it with implant volume. I try to really minimize that.
I've never understood
with these
that
surgeries.
operation.
Yeah, exactly. Yeah.
But you get patients who come in and they tell me, I want a reduction with an implant.
Right.
You know, and I'm like, I'm not going to take away your healthy breast tissue just to replace it with an implant.
Right. Exactly. I have the same.
But it's definitely a thing. It's a thing.
Yeah, for sure.
Now to the right side. So Dr. Polo's going to take out the 13-year-old saline-filled implant.
We've opened the capsule the same way as the other side. So let's see. This implant looks a little more filled. It's not as slack as the other.
Can you make the breasts exactly the same?
No, I was having the same thought. So yes, of course, it's always important to tell the patients that that's not really the goal. The goal is to make them more similar. We can make them more similar, almost always.
As I tell my patients, they're sisters, they're not twins.
Right.
She had saline implants and she's switching to the gel-filled implants. Do you find that most patients with the salines now want gel?
Yeah.
I tell my patients that the saline implants are the iPhone 5 and the gels are the iPhone 10. You put it in terms they can understand.
Okay.
Looking good.
Yeah, it is. Sit it there nice and natural.
Very nice.
And now we tie it up.
We finished up the breasts, and now we're going to go start and do the tummy tuck. Part 2 of the Max Makeover. So Max, tell me what you're going to do here.
So we're doing a full abdominoplasty for her. Her main issue is laxity of the muscle. Remember, she had twins, and she had, you know, a big twin pregnancy. She went to, I think she said 36 or 38 weeks, so almost full term. So her muscle and fascia was really stretched and never came back to normal. She's very thin, but she's got this pooch. So we've got a lot of tightening of the muscle fascia to do.
Sounds good. So she had a C-section before.
Yeah.
And she made an excellent scar.
Yeah, she did. Really minimal.
Yeah, no, you can't even see it. That's
good as it gets.
That's the best predictor of what her tummy tuck scar will be, right? How do you know how much skin to remove?
Well, we want to remove as much as we can without excess tension.
What do you say when the patient asks, are you going to make a new belly button?
And I use 2 different techniques. I'll make an oval-shaped belly button, or I'll make a hooded, more circular belly button. If you have a more normal-looking belly button, as long as we're careful in the way we make the new belly button, they should still have a nice-looking belly button. So.
No, it's very important, especially in South Florida.
Right.
You know,
right.
People are in bathing suits all the time.
Right.
And you can go to the beach and you can see the patient who had the bad tummy tuck because their belly button's too big and it has stitch marks all around it, and it's just obvious.
Yeah, yeah.
So this is interesting, Max, how you're pulling all this tissue back together that got stretched out during her pregnancy, and you can kind of see everything moving back together, which will basically give her a flat tummy after surgery.
Yeah, exactly. You see how much more flat it is now.
Right.
We're going to imbricate a little bit more. It's pretty tight here down below, but around the belly button there, we're going to be able to tighten that up just a bit more with the next layer.
Right. And that's one of the things she told me pre-op, which was very important for her, was to be flat.
Right. Yeah. Yeah, flattens the tummy on profile and also pulls the waistline in and narrows the waist.
Yep.
You don't want to go crazy and, you know, over tighten it, because the tighter we make this, the more pressure we increase.
I think that's the art of surgery, isn't it? I mean, anybody can look at a textbook, but you've got to have the feel for how tight to make things.
Right. Definitely a lot of art to plastic surgery. I mean, that's one of the reasons I chose the field, because there's not necessarily a textbook recipe for every operation, right?
That's for sure.
There are standard guidelines, but a lot of it is techniques that you develop for yourself and, you know, customize to each individual patient.
Like a true artist or a Michelin star chef, Dr. Polo is a master of his craft. Coming up next, we see Melissa's gorgeous results. I hope you're enjoying the show. To see me as a patient in my practice at Miami Plastic Surgery, you can request an appointment online at miamiplasticsurgery.com or give us a call at 305-595-2969. My focus is facial cosmetic surgery and injectables such as Botox and fillers. I can't wait to see you and help you achieve your dreams. It's been 2 months since surgery, and Melissa looks amazing.
Miami Plastic Surgery, from the doctors to the nurses to the anesthesiologist, everybody was great. I never had a problem. Everything went smoothly, and I'm very happy with the outcome and the care that I received.
What a great job Max did. Be sure to join us next time on Slices.